As a part of your protocol, your doctor has prescribed you hCG injections. We're going to cover how to mix and prepare hCG 1500 and 2500 unit dose in this video. Your nurses will help you know which dose you'll be doing. First, you will have picked up your hCG from the MFC dispensary. It looks like this. It comes in a box like this. And inside the box, you'll see that there is 2 vials, one that has liquid and one that has a white powder. You'll receive some needles with it. So there'll be a big needle like this for mixing, and then a smaller needle for injecting. It may be this 1 ml orange cap syringe, or it may be a clear 1 ml syringe with a needle tip beside it. First, you'll take the plastic caps off of the top of your vials and use an alcohol swab to clean the top of each vial. Next, you'll choose your bigger needle first for mixing this injection. When you take it out of the package, make sure you just twist the top a little bit to make sure the needle is nice and secure to the syringe. You'll take the cap off the needle and pull back a little bit of air into the syringe and inject it into the diluent vial first, so the vial that is full of liquid. You'll turn that upside down, making sure the needle tip is still in the liquid. Push your air into the syringe and pull back 2 mils of fluid. So you'll fill it up until your plunger is at the 2 mil mark on the syringe. And then you can pull the vial off and inject your 2 mils into the white powder vial. And then you'll swirl it around. You'll notice that the white powder dissolves almost instantly and you'll be left with a clear fluid again. Then you can take the needle out and set that one aside. Now your medication is mixed. Then you'll use your 1 ml syringe, and when you're doing hCG 1500, we'll do that one first, you'll pull back to about 0.3 mils or 30 units on this orange cap syringe, and you'll inject that into the mixed medication, so the one that the white powder was in. You'll push your air in, turn it upside down, and pull back to 0.3 mils or 30 units on the orange cap syringe. Then you'll take that off. If you have any big air bubbles or anything, you can kind of flick the needle a little bit. You might pull back so that all the air kind of gets to the top, and then slowly push the plunger up until a bleb of fluid comes out the top of the needle. If your dose is 2500, then you'll do exactly the same process, but when you're drawing your medication back into the syringe, you'll go to 50 units or 0.5 mils. Now your medication is prepared for injection. Now that you've prepared your medication, we're going to talk about how to perform an intramuscular injection. First, we'll talk about a partner performing it on the person receiving the medication, and then we'll go through how to do this medication on your own. These injections will go in your glute muscle, in your buttock. We're aiming for the upper outer quadrant of your buttock. So imagine that your glute is divided into 4 quadrants. We're aiming for the upper outer quadrant of this muscle. When you come to clinic, a nurse will very happily help you to landmark this area. So we can write right on your skin so you know exactly where you're aiming. And then within that area, you'll sort of try to move around each day so that you're not poking in exactly the same spot every time. When you're having this injection performed on you by a partner, you should be in a position that allows you to have your leg as relaxed as possible, whatever leg this is going into. So particularly if a partner is doing it for you, maybe you could be laying down on a couch or a bed on your side so that the side they're going to inject is facing up, but you're completely relaxed. Otherwise, you can be standing, have something to lean on, and just make sure that you have this leg as relaxed as possible when you're going to perform the injection. Once you're ready, you'll take an alcohol swab and clean the area, and then let that dry. And then partners, you'll take the needle cap off. You'll pull the skin taut so it's nice and tight, and you'll go in quick like a dart about 2/3 of the way down the needle, and then push in the medication as slowly as you can until it's all been delivered. And once you're done there, you'll pull it out. A little bit of blood, a little bit of liquid might come out. That's normal. Use this tissue to hold pressure on the area until it stops bleeding. And then give it a little massage, work it around to help that medication get worked in. Make sure when you're done, you put your used needle safely into a sharps bin or your medical waste bag. When you're performing this needle on yourself, you'll have a little bit different approach. Now that your intramuscular injection is prepared, we're going to talk about how to perform this injection on yourself without a partner. We're aiming for the upper outer quadrant of your buttock. So imagine that your glute is divided into 4 quadrants. We're aiming for the upper outer quadrant of this muscle. Your nursing team here at the clinic will happily help you landmark this area. So when you meet with them, they'll be able to draw right on your skin so you know exactly where you should be injecting this medication. Each time that you do it, you'll try to move the injection site a little bit so that you're not poking into exactly the same spot that you did yesterday. When you're ready, you'll use an alcohol swab to clean the area in preparation for injection. Now that the area is clean, you're going to set your body up for performing this injection. And the best way to do that when you're on your own is to sort of have a chair or a bench or something nearby that you can sort of get one knee up on, the knee that you're going to be performing the injection on, so that the weight is kind of taken off of this leg as much as possible. We want this muscle as loose and relaxed as possible when you're going to perform this injection. Now, usually you're not going to be able to see the site that you're injecting into, but that's okay. You know where it is. You can use your hand to sort of feel where that injection is going. And when you're ready, again, trying to keep this muscle as relaxed as you can. You've already cleaned the area. You're going to take the lid off of your prepared medication, and you're going to inject just like this at 90 degrees, nice and slowly, about 2/3 of the way down the needle into your skin. And then you'll push the plunger as slowly as you can tolerate, just like this. And then when you're done, you'll pull it out. A little bit of blood, a little bit of liquid might come out. That's normal. Use a tissue, hold it on your skin until the bleeding stops. And then make sure that you put your used needle into your sharps bin or your medical waste bag when you're finished with it. Now that you have your medication prepared, here's a video on how to perform a subcutaneous injection. First, these injections are going to go into your abdomen. So you'll pick a spot 2 fingers away from your belly button and inject anywhere in your tummy. The injection is going into that fatty layer of tissue right under the skin. So 2 fingers away, anywhere in your tummy, just like this. When you're doing your injections, you'll pick a spot and then you'll rotate your sites. So try not to poke into exactly the same spot as you did already today or yesterday. Try to rotate the spots a little bit, even a finger away is helpful. When you're ready, you'll use an alcohol swab to clean the area that you're going to inject into. And then you'll give that a few seconds to dry. You'll take the cap off of your prepared needle and pinch your skin where you're going to do the injection. You'll inject at 90 degrees all the way in. Push the plunger on the syringe down until all of the medication has been delivered. Then you can relax your skin and pull out the needle. A little bit of blood, a little bit of liquid might come out. That's okay, it's normal. You can use a tissue to hold the spot until the bleeding stops. And then when you're done, make sure that you put your used needle into a sharps container or your medical waste bag.